Hello, everyone, and welcome to PEBC OSCE's case for today. Sometimes in our practice, we see cases where we are not able to solve the problem as pharmacists. We do need to refer our patients to other healthcare professionals in order to get the correct answer and the data in order to help them better. Such a case needs referral of the patient to their healthcare provider, and we are going to see how we can assist a patient in such a case today. Our door note today says that a patient is coming to you with a concern. Do as you would in your regular practice. Whenever you see that you have a patient-centered case, do not forget to write DOSAM, the abbreviation that stands for all the questions that you need to ask a patient in order to retrieve all the important information before giving the correct recommendation. Secondly, you do want to keep your empathy and sympathy skills out so that the patient feels comfortable and welcome in your presence. And third, you want to keep in mind to use easy language so that the patient can easily understand you. Once you go into the room, you will have an assessor give them your barcode, have a quick look at your references. You will have about 20 seconds before the patient comes in. Once they do come in, acknowledge them by standing up and giving them a smile and introducing yourself. Hello, sir. I'm Tina. I'm the pharmacist on duty today. How could I help? Hello. I just don't know what to do. My entire body seems to be aching. I'm so sorry to hear that, sir. Would you like a glass of water? Would that help? No, I'm okay. Thank you. Please have a seat, sir, and I would definitely like to help you out today. Except for the symptoms that you are experiencing, that is the muscle aches in your body, is there any other symptoms or anything else that's bothering you? No, but that's bothersome enough. For sure, sir. I can only imagine the pain that you're in right now, and I would definitely want to help you out. So you said that apart from the pain, there's nothing else that is bothering you, thankfully. And I would want to have a quick look at your profile and go through it with you before I can give you the correct recommendation as to how we can get this corrected. So you have been to a pharmacy before, is that right, sir? Yes. Okay, and just to make sure, you did not have a fall, you did not hurt yourself in any case? No, I did not. Okay, I'll have a quick look at your file, sir. Here I see that your name is Mr. Richard Allen. You are 51 years of age. You're allergic to dust and pollen. You are currently on 3 medications, the Ramipril 10 milligrams, 1 capsule a day, amlodipine 5 milligrams, 1 tablet once a day, and the rosuvastatin 10 milligrams, 1 tablet a day. Is that correct, sir? Yeah, that seems right. Whatever you have over there is my most updated profile. Okay, that's good to know, sir. Just want to make sure that there's no new allergies, no new prescription medications. No, there isn't. Do you by any chance drink any grapefruit juice or anything else? No, I don't. I don't really like fruits or their juices. Okay, sir, that's good to know. And just wanted to also make sure that you're not taking any over-the-counter medications, any herbal medications. No, I'm not. Okay, I'll definitely have a look at my references in order to see why this is happening. I will also try to help you out by maneuvering you in the right direction as to what we can do further to alleviate this pain for yourself. Do you have any other questions in the meantime for me, sir? No, I don't. Okay, sir, just give me a few minutes and I'll have a quick look into my references. Just FYI, guys, we do want to be a little bit better than the others. We want to cut above the edge. So we do want to offer him some sort of sympathy. We do want to offer him a glass of water when he comes in just to make him feel more welcome. I know that sometimes their pain is a lot. They may come in agitated, the patient. So we just want to calm them down, just make sure that they understand that we are here to help them. Now, we do have a few references sometimes, maybe multiple references in the OSCE stations. So make sure that you look at everything that's on your OSCE station. You also want to use the references that they give you and not your prior knowledge for 2 reasons. One, your prior knowledge may be outdated, which you do not want to risk giving out to the patient. Number 2, the answer that the assessor is looking for is probably in these references. So we do want to use these references as much as possible to give the answer to the patient. Now, going to the reference, as per our first reference, we do see that Crestor or rosuvastatin is implicated with skeletal muscle effects, increases the risk of myopathy and myalgia for patients who have been on it on any dose. Of course, it is dose related, but it can happen to patients on any dose at all. So the first answer to his question would probably be that his muscle ache, especially generalized muscle ache, is usually because of the statin that he's taking. Now, in order to answer his second question, how to manage this better, the algorithm here states that the patient with muscle-related symptoms who probably has statin-induced myopathy, We do need to take their history, physical examination, and we need to know their creatinine kinase levels in order to see what we want to do better. So there's 3 options, each one depending on the creatinine kinase levels. Now, had it been a healthcare provider like a nurse or a doctor, they may have that information on them, so we can ask them about it. You can also ask the patient about their levels, but usually the patient won't know. No problems in asking, just to make sure. In this case, the patient did not seem to have the answer to any other thing other than the profile, and that too, he said that what you have is the most updated one. So seems like he doesn't have this information. So we do need to refer him to the right healthcare professional, most probably his primary care provider, like a family physician, to order the tests so we can see what to do next. Thank you for waiting there, Richard. So, as per my reference, it seems like the statin, the rosuvastatin that you're taking for your cholesterol, and you said you do take the 1 tablet once a day. Is that right? That is correct. Okay. If you're taking it as prescribed and you're still having muscle aches, this medication or the statin class of medication is usually the cause of such generalized muscle aches, unfortunately. So I think that's the medication that's causing you this ache and this discomfort. I would have to refer you to your family physician or your healthcare provider who can order some lab tests to make sure that this is the reason for your pain, just to make sure. And depending on the levels of a specific enzyme that would dictate whether or not it is the statin causing you this problem, they will take a course of action, which may range from either reducing the dose of the statin, maybe even stopping it for a little bit, or maybe just discontinuing it for a period of time. Now, that is something that, again, the doctor or the nurse practitioner or your family provider would have to do. So I would have to refer you to them. Just to make sure, do you have an upcoming appointment where you could discuss this with your doctor? Yeah, actually, I'm actually going to see him in a couple of days. I had a booked appointment with him for something different. Okay, in that case, you could discuss this with him, and then the doctor could probably order the lab tests and guide you better as to what he would want you to do. If you'd like, I can also fax your doctor giving him a summary of our conversation today in case he does want you to stop the medication before you see him, or we can have an answer maybe sooner than your appointment. Would you like me to do that for you? Yes, for sure, I'd appreciate that. No problems at all, consider it done. I'll fax your doctor for you. I hope you do feel better soon. Would you want me to book a cab for you? No, I have a ride. Okay, just don't forget to give me a call if you have any questions for me. I hope you have a great day and you feel better soon. Take care, Richard.